a lot happened during the COVID times, and basically the children were confined to homes. They were not allowed to go out. They were not allowed to step outside the house also. They grew up, and in 1.5, 2 years, the child literally grows phenomenally. So if the child is not going out, stepping onto the grass, is not stepping out on the mud, is not running around, so what has happened is they are developing deformities of the knee, the angular deformities, the genu varus, the genu valgus. There are times when they have deformities of the spine. Basically, they are glued to the TV, they are glued to their mobiles, and since they started off with the laptops very early, because initially they were not using the laptops, but after the COVID, their classes were on laptops, they were using mobiles and laptops, so the postural deformities they came in. So what we have to realize is the children need to go out. They don't have to study the whole day. They have to go out, they have to step onto the grass, they have to know what mud is. Since whenever you're walking because you're walking on 2 feet. Animals, they have 4, we have just 2. So whenever you're walking as if your weight goes onto the outer side of the foot. But when you have flat feet, when the muscles are underdeveloped, you have flat feet and your foot falls on the inner aspect, and this is what is leading to ankle and the knee troubles. And this is which is going to give you an epidemic later on of joint replacements for knee and hip, as well as the spinal deformities. So we have to send the young children to school with sport shoes on. We are not preparing them for boardrooms. So they should be told to wear sport shoes. They are supposed to go out and play in the grass without their shoes, so that they know that they learn to train their muscles of the feet, and they develop lesser deformities than they have started of late. For me, all my knee joint replacement surgeries are robotic surgeries only. Even if the patient cannot afford it, I'll still do a robotic knee, and rather than doing a conventional knee surgery now. I have been doing it for the past 32 years now, but I am married to my robotic arm now. One, because I don't open up the marrow, so there is practically very little blood loss. We don't change the hematology of the patient. We are not damaging the marrow. We use a very smaller incision. Soft tissue dissection is very less. The alignment is just perfect, and the patient is absolutely pain-free. The patient is pain-free because of the newer blocks, the newer anesthesia techniques, and the patient can walk the same day or maybe the next day, and patient can go back home in 3 days. So the impact of the robotic arms is amazing. The misconception is that robotic arm is doing the surgery. No, you are still doing the surgery. It's just telling you the alignment of the hip, the alignment of the knee, and alignment of the ankle, so that you get one straight line, whatever alignment modality you use. But the alignment that you get is far better than the eyeballing that we used to do with just the eyes. So it's very comfortable for the patient. The alignment is very good. Patient is pain free, and we use a very, very small. The soft tissue dissection is very less. So the healing is good, proper, and very early.